Hello everyone, welcome back to my channel. So in this video we will talk about ergot alkaloids. So what are ergot alkaloids? So ergot is a fungus which is Claviceps perfura, and it grows on rice and some other grain, and eventually the grains are being replaced by a purple hard and curved bodies which are known as sclerotum. And ergot poisoning, that is known as ergotism, it eventually causes painful dry gangrene of hand and feet, which eventually become black. Okay, that occur due to vasospastic ischemia, and they also are found causing miscarriages in women as well as in cattle. So these are contraindicated in pregnancy. And ergot had been used by midwives to quicken the labor, because we will study about that it causes the contraction of myometrium, so it helps in induction of labor. So now the natural ergot alkaloids. Okay, these are tetracyclic indole containing compound, and they are derived from lysergic acid, and they are divided into two types. One is amine alkaloids and another is amino acid alkaloids. In amine alkaloid we have ergometrin, and in amino alkaloid we have ergotamine and ergodotoxin. They are vasoconstrictors and they are also alpha adrenergic blocker, and they are partial agonist. Okay, so they are partial agonist. And this ergotamine is oxytocin. Okay, so now we will discuss about the semi-synthetic derivatives. So they are in three classes. One is dihydroergotamine, which is DHEE, so in which we have dihydroergotoxin as well, and both of these are they are anti-adrenergic cerebroactive. Okay, and the second class is bromo compound. These are 2-bromo alpha ergotacriptin, which are dopaminergic D2 receptor agonist. Okay, and this is last is methotrexate. We had discussed in the last video, and that they are mainly anti 5-HT. Okay, now we will discuss about the actions of each of them. So firstly we will discuss about ergotamine. These are partial agonist and antagonist at alpha adrenergic and all the subtypes of 5-HT1 and 5-HT2, but they does not interact anything with 5-HT3 or dopaminergic receptors. Okay, but they causes sustained constriction. Why does they causes sustained vasoconstriction? Because of very slow dissociation from receptors. So now they are binded to receptor, and the dissociation from the receptors is very slow. Because of that it causes sustained vasoconstriction, and they also causes visceral smooth muscle contraction as well as vasocenter depressions which are being produced, and the action of non-epinephrine and 5-HT are on smooth muscle, they are antagonized. Okay, so however the overall effect of ergotamine on BP is insignificant, but it is a potent emetic through CTZ and vomiting center, and they are moderately potent oxytoxic. Okay, on high doses it stimulates the CNS, otherwise it does not stimulate. And on chronic exposure, when we are chronically exposure, when we are using ergot alkaloid for a long time, it causes ergotism, that is ergot poisoning. So vasoconstriction occur, that is accompanied by damage to capillary endothelium, and eventually there will be vascular stasis as well as gangrene. Okay, now we will discuss about another drug, that is dihydroergotamine. So these are, when we do hydrogenation of ergotamine, it reduces the serotonergic and alpha adrenergic agonist action. Okay, but it increases the alpha receptor blocking property. Okay, so consequently DHE is a less potent vasoconstrictor, and primarily it constricts which vessels? Capacitance vessels. Okay, and they are weaker emetic and oxytoxic. So now we will discuss about the another drug, that is dihydroergotoxin. So they are the hydrogenated mixture of ergotoxin groups. Okay, and they are more potent alpha blocker but a weak vasoconstrictor. And dihydroergotoxin has been advocated for the treatment of dementia. Okay, because it also enhances the acetylcholine release in the cerebral cortex. Okay, so it has actions on CNS. Now the another drug, bromo compound, that is bromocriptin. It is a relatively selective dopaminergic, we had discussed, D2 agonist with a prominent action of pituitary lactotrope. Lactotrope means lactating, so it inhibits the prolactin release, and in CTS it acts, and it is a emetic. Okay, it causes vomiting. So emetic action is weaker than that of the ergotamine. Okay, now we will discuss about ergometrin, that is ergonovics govin. So they are very weak. Eventually we can say these amine ergot alkaloid are very weak agonist, and practically there is no antagonist action on alpha adrenergic receptor, and the vasoconstrictor is constrictor action is also not very significant. But they are partial agonist of 5-HT2 receptors, which are powerful uteronic effect. Okay, it is the moderately potent 5-S2 antagonist in GI smooth muscle, and a weak dopaminergic agonist on the pituitary lactotrope. Okay, so it is not that much significant, but the most potent action is the contraction of myometrium, because of which it is exclusively used in obstetrics, because there is no other action that is so significant. But as you know, these are they causes the most potent action of this is contraction of myometrium. So there is a question that has been asked, that why we don't use ergot alkaloids in pregnancy, why they are contraindicated, because as you can see they causes the contraction of myometrium, so they can cause miscarriage, or they can quicken the labor, right? So now we should discuss about the pharmacokinetics of ergot alkaloids. So the oral bioavailability of amino acid alkaloid is very low. Their hydrogenated derivatives की भी बहुत low होती है, and due to the slow and incomplete absorptions, and also they have a high first pass metabolism. So overall their bioavailability is very low, but bioavailability is higher after sublingual or rectal administration, but still it is not that significant. So they are metabolized in liver, excreted in bile, and they effectively crosses the blood-brain barrier. And the adverse effect are nausea, vomiting. We have discussed that it has emetic action, abdominal pain, muscle cramp, weakness, chest pain. Okay, the chest pain is because of what? We had discussed it earlier as that it might be due to coronary chemo reflex, right?